What's happened is we have a spiraling, haves and have-nots in this country, and the have-nots are getting weaker. And I've said repeatedly over the years, but it's true, and I think people in this industry know this, is that once you get into a negative spiral, once you start to have problems reinvesting in your community to financially provide the technology, the equipment, the services that you need, you start getting into a downward spiral, and once you do that, it's hard to get out.
LHP is a private company, and we were formed by a group of managers and private investors who saw an opportunity and a need to work with not-for-profit health systems or hospitals in our country. Approximately 85% of the hospitals in our country are not-for-profit, and many of them have great reputations and a great history of providing quality care in their community, yet in these very difficult times, in a very difficult financial environment, have had a difficult time recapitalizing, replacing, expanding, and growing.
One of the things I hope that that motivates me to want to keep kind of working in this field is that there are a lot of opportunities out there to help communities that need help. Organizations that have been in their communities, many of them for 100+ years, and they're there because the community needs them to be there, but they are not able to meet the changing needs of the community, and they need assistance, they need help. And they don't want to give up their hospital. They don't want to sell their facility. They don't want to lose their hospital. And they're starting to look at what are my alternatives.
For LHP, I think the biggest determining factor in our business success will be the quality of care we provide to our patients. It is just, the outcomes that we generate in our hospitals, the relationships that we have with the communities that we serve, and the quality of the care that we deliver to those communities will determine whether we're successful or not successful in the long run.
Our goal is to form these partnerships in such a way that the local nonprofit community hospital remains local and remains in a environment where it's competitive and has the capital to expand its facilities, to replace its facilities, to recapitalize itself in an efficient manner, which is very difficult for half the hospitals in our country today.
We started at LHP to reach out to healthcare organizations in this country who had a need for capital or a strategic need that they could not meet on their own. And we're looking for help in meeting a community need.
The debt market and debt financing is a very difficult way to continue to do business if you want to grow and recapitalize yourself. And so our strategy basically is to be their capital partner and share the decision making and share the governance with nonprofit corporations so that they do not have to give up control of their hospital or sell their hospital in order to get the capital they need to grow.
What I see is a world with a large number of not-for-profit hospitals, many community hospitals that are struggling to keep up with their capital needs, that are struggling in the context of the difficult economic times we face today. What LHP is doing is really serving community needs, bringing capital, bringing management expertise, raising the level of engagement of the staff at these hospitals.
You as a public company or a privately held company or a religious organization, you can own the bricks and mortar in hospitals anywhere in the country for the most part. But if you lose the fact that the hospital really belongs to the community, you've missed it.
Healthcare is really a community-based service, and the components with the physicians, the staff of the hospital, the trustees, and the people in the community have to collaborate to identify what their needs and preferences and values are to create a personal, identifiable healthcare experience for every patient.
Culture is really, based upon the people you work with. I mean, it's, shared vision, shared values, and, our objective with the company is to create a culture that is committed first and foremost to taking care of patients. And that's why we look at healthcare. We look at healthcare as that, if you're in this business and the primary purpose of the business is to make money, you're in the wrong business. This is a business of taking care of patients, and that's where the culture starts.
I think our culture is unique, and our culture in every sense of the word is based on collaboration, working together with others, sharing the decision making, sharing the governance and how we operate our hospitals.
We found this leadership group to understand the importance of the medical staff, of the physicians being a part of the decision making, and that again was a tenet for us in terms of how we do business. And finally, it was the focus on the patient, and ultimately that's what we're about.
We strongly believe that hospital decision making should be made locally, and so all our hospitals will have local community leaders. We collaborate and work with our medical staffs in a unique way so that our doctors feel that they really do control the environment in which they work.
The physician brings a unique perspective to the table. He is the person who knows best and most deeply what the patient needs and what the patient requires, and can articulate that voice at the governance table better than anybody else can.
What we've learned is that when you get physicians involved and you get them with local community people, the power of those groups working together in the best interest of the community, but using the clinical and technical expertise of the physicians really improves care in the community, and it works. And so it's a strategy that we think is not only a good strategy, business strategy, it's a good strategy in terms of improving patient care. One of the things that I've really enjoyed in my career was I've met so many good people who really have that kind of shared values, shared vision, and a shared culture about healthcare and what are we here to do and what's our purpose. And so one of the great things about starting LHP has been to create a board that brings some of the top healthcare providers in the country together who have a view that there are a lot of healthcare systems in this country in trouble. And they don't want to sell their hospitals. They don't want to lose local control, but they need some help in sustaining that or engineering growth to meet the needs of their community that they can't do by themselves.
In a complex environment that healthcare is today, I think it's more important than ever that we have common cultural background and beliefs and goals and mission statements.
LHP has a very strong management team. As a combined group, we average approximately 30 years of experience in managing community hospitals. We've also started a company in the past and grown it to a very large size, so we have good experience growing and building companies like this. Our particular expertise, though, is in structuring joint ventures. Our management team has done more joint ventures or capital partnerships with not-for-profit than any other management team in the industry. As I like to say, we're not practicing as we grow this company and differentiate ourselves by building joint venture partnerships with not-for-profit systems. I think where we can have an impact on a local level is community by community, where we can help work with that local community hospital and keep it local and keep it community.
Everybody has kind of a vested interest in how good and effective healthcare is in their community. And we want those people, those vested stakeholders, to have say-so in what's happening in their community.
Our culture is unique, and that in many ways our strategy and culture is much more like the nonprofit environment, in that we're working with communities that we operate in. We share the decision and the governance with local leaders.
I have great hopes for the future of LHP. I think it is going to make a difference today in helping hospitals be successful. But more importantly, I think it's going to demonstrate a new model of how hospitals can be financed and how expertise from the for-profit sector can work with community hospitals to preserve the great legacy and the great commitment of community leaders to their hospitals.
Life's pretty short, but if you get to the end and you can say, I left it better than I found it, then I think you've accomplished something. And maybe you've made a difference in somebody's life. Maybe you've helped somebody's family, their kids or their wife or their husband, and you made a difference. And that's what motivates me at this point in time, is to be part of something that you can feel good about. We're doing something and doing it well.